prescription.
Hi, how are you?
Hi, I'm good, thanks. What can I do for you?
I've just come here down from the doctor. They've discharged me today and they've asked me to collect my medication from the pharmacy.
My name's Eden, I'm the intern pharmacist here. I can definitely help with that. Can I just confirm your name and your date of birth?
Yeah, sure. So it should be Annabelle Davidson for the name. And the date of birth is the 16th of December, 1985.
Excellent, okay. I'm just going to check our records for that one.
Yeah, sure.
Okay, Annabelle, we have your records here. It looks like you were diagnosed with a pulmonary embolism, is that right?
That's correct, yeah.
So I think the medication you'd be picking up is apixaban, is that right?
From memory, yes, that's what the doctor told me.
We've got all the relevant information. We can get that done for you.
What has the intern done well in this intern-patient interaction? What could be improved? An intern needs to consider many factors when receiving a prescription order. Gathering additional information is essential for determining the appropriateness of the medication. For the preceptor, assessing an EPA involves 3 key steps. 1. Undertaking short practice observations. 2. Having an entrustment discussion with the intern. 3. Making an entrustment decision.
How are you going there?
I'm good. Just reviewing a prescription for apixaban.
Oh, okay. Is now a good time for a short practice observation?
That'd be great, actually, yeah.
While an intern is likely to be observed regularly, a short practice observation is a more structured observation of their performance. It's important the intern and preceptor are both aware that the EPA will be observed, evaluated, and that feedback will be provided. The intern and preceptor must also agree on the standard the intern will be assessed against.
Okay, so I'm just reviewing this prescription for apixaban. It's appropriate in its indication. I mean, our patient has a PE, a pulmonary embolism, so that's fine. Looked at her age and her weight and her renal function and everything seems to be fine there as well. However, I'm a little concerned about the dose. So the dose appears a little low. It's 2.5 milligrams BD. I'm just having a look at the therapeutic guidelines and then the AMH. So therapeutic guidelines say it is a little low.
And what makes you think it's not the right dose for her?
We'd be seeing that sort of dose if they had impaired renal function, potentially, or if they were very elderly. But as I said, she's mid-30s and otherwise very healthy.
Okay, yep.
Yep. The AMH, I'll just double check. Yep, again, it seems a little low for someone like her. So what I'd really like to do is maybe clarify with the doctor and potentially get that dose fixed up. Do you think that would be a wise way to go?
I think that's a great course of action. And I think once we've got that issue resolved, we can dispense that new script and go ahead.
Consider this short practice observation. What can you adopt in your practice as an intern or preceptor? Interns are encouraged to drive their own learning by seeking preceptor observation and feedback. A short practice observation won't contain all possible situations, so preceptors may need to extrapolate likely performances beyond what has been observed. In an entrustment discussion, preceptors can pose what-if questions about potential scenarios, which can help the intern understand how they might act in future situations.
So great work today. I have a couple of things that I'd like to discuss with you in our feedback session. Firstly, I want to talk about decision making. Yeah. So what did you consider in the patient's medical history to determine that prescription was safe and appropriate?
Well, first off, I thought about her diagnosis. So she has pulmonary embolism. Apixaban is appropriate for that indication. As the first thing. And then the dose was really important because it was actually a bit low for her.
Yeah, and I think you did really well on picking that up. Did you think to ask about medications?
No.
And what about social factors such as smoking?
No, I didn't think about that.
Okay, so medicines containing estrogen, such as the contraceptive pill, and smoking can actually increase one's risk of having pulmonary embolism. So taking the time to gather some more of that information could be really helpful. So I encourage you to do that in the future.
The preceptor evaluates the intern's understanding of risk. In this case, they failed to consider the patient's use of oral contraceptives. The preceptor may also ask what-if questions. For example, what if the patient in this case were elderly? As a preceptor, what information would you need to entrust the intern with greater autonomy? The final step in the assessment of EPA is making an entrustment decision. An entrustment decision is a point-in-time judgment when the preceptor determines the level of supervision the intern will need to continue carrying out the EPA. There are 4 structured levels of supervision for interns. Level 4 allows interns to perform EPAs with minimal supervision. In this scenario, the supervisor believes the intern will continue to benefit from indirect supervision, which is consistent with supervision level 3.
Based on what we've discussed here and using the EPA framework, I'm going to assign you a level 3. And now we have areas we will focus on during future dispensing activities.
Thank you for your time. That's actually been really helpful for me.
Entrustment decisions should draw upon evidence collected across multiple short practice observations, feedback from other supervisors, and reviews of relevant documentation completed by the intern. For example, a dispensing log provides information that the preceptor can use to make an entrustment decision on the dispensing EPA. Overall, entrustment is the basis for allowing interns to carry out tasks with greater autonomy as their performance improves. Reflecting on their performance provides interns with insight into their strengths and weaknesses. Reflecting on their past performance gives a chance to consider how they might handle a related activity in the future. Preceptors should help interns develop a helpful, reflective practice.
I really like the scale of progressing through the stages up until entrustment level 4, which is of course when I can practice independently. And getting feedback from my preceptor lets me know how I am progressing towards that goal. The feedback that she gave me I don't see as being negative. She didn't focus on what I did wrong, she actually told me just how I can improve practice in the future. I find that this feedback has been invaluable to me as my experience as an intern.
So I make decisions about how much supervision is required for my intern pharmacists each and every day. This particular framework helps me feel more confident about the decisions that I'm making. It is good that I can draw on the entrustment discussion after medicine dispensing activities to inform my assessment of EPA.
In this video, we introduced Entrustable Professional Activities, or EPAs. We've seen how a short practice observation followed by an entrustment discussion can enrich feedback, enhance intern development, and inform the assessment of EPAs. For more information on Entrustable Professional Activities, visit the APC website on www.pharmacycouncil.org.au.